video. For some things, I may just say it and explain it instead of doing it like the instructions said, like lifting clothing and things like that. So for our scenario, this is a patient who is in the hospital after surgery for fractures in his wrist. So, hi Mr. Gardner, my name's Marina. I'm going to be your nurse today. I'm just going to wash my hands.
Okay.
So I'm here to do your head to toe physical assessment. Is that okay with you?
That sounds fine.
Okay. Can you go ahead and state your name and date of birth?
Logan Gardner,
I'm just going to confirm with your wristband
6/19/95.
and with my medical record here. Okay. I'm just going to assess your orientation. Do you know what the date is today?
It is January 17th,
Okay. Do you know the year?
2022.
You know why you're in the hospital?
I broke my wrist.
Okay. Are you having any pain today?
No. Oh, yes.
Where would you rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable?
It's about a 6 right now.
Okay, and has the medication we've been giving you been helping your pain?
Not really. I'd much rather be at a 2, but it's just not going anywhere.
Okay, so it looks like we've just been giving you Tylenol, so I will talk with the physician about getting you something to better treat your pain.
All right.
Okay? All right, and I can tell just by walking in that the patient's airway is patent, he's breathing, so good for my ABCs if present. And this is a private room, so there's no need to like pull a curtain, the door is shut. I'm gonna go ahead and take your vital signs.
All right.
And I would have gloves on in this scenario. So I'm not gonna take it where you just had surgery. You can relax your arm. Okay. 128/64. Get your O2 saturations. 98.1. That's 96%. I'm going to listen to your lungs.
All right.
And so on the right, I will listen to the upper, middle, and lower, and the left will be upper and lower. And I'll also listen anterior and posteriorly. Now, I would be pulling the patient's gown down because clothing can obscure the sounds, but for the stimulation, I'm not going to do that. Take some deep breaths for me. Alright, can you sit forward? Okay, you can sit back and breathe normally, and I'm going to listen to your pulse, your heart rate apically for 1 full minute. so 1 full minute is apical pulse rate is 72. And usually I'll add some time while listening to the apical pulse and also count the respirations because you're normally breathing normally. I'm just gonna use my pen light to take a look at your eyes, okay? Can you open your mouth for me? Okay, I'm gonna check your radial pulse on both arms to compare. Just gonna be gentle on your right wrist. Do you have any numbness or tingling in your fingers?
No.
Okay, can you squeeze my hand on both sides? Good. So the grip is a little weaker on the right, which I would expect after surgery, but the pulses are both equal bilaterally. I see that you have an IV in your right arm, so I'm going to go ahead and assess that. Do you have any pain at your IV site?
No.
Okay. So the IV site looks good. The dressing is clean and intact with no soiling. There's no redness or swelling. So this is just a peripheral line, so I'm not going to be checking like blood return. But I'm going to flush it to assure that it's patent. I'm going to scrub the hub with alcohol swab first. Then I'm just going to flush it. Okay, your IV's working good. I'm going to go ahead and clamp it. Okay, just going to check his skin turgor. Looks good, which the skin turgor, if there's any tenting, would be a sign of dehydration. So I'm going to assess your abdomen. So with abdominal assessments, you would actually listen before palpation because palpation could, make the sounds different. But so upon inspection, there's no distension in the abdomen. Do you have any pain in your abdomen?
No.
Have you been having normal bowel movements?
Yes.
So I'm going to listen in all 4 quadrants of the abdomen. Now in order to determine like absent vowel sounds, you would have to listen to each quadrant for 5 full minutes. When his vowel sounds are active. Okay, so I'm just going to palpate your abdomen. You let me know if you have any tenderness or anything. I'm just going to use my hands. Do each quadrant of the abdomen. Abdomen is not taut, no masses. Now percussion is usually done by, physicians or advanced practice providers, so I'm not going to be performing percussion. Have you been having any issues urinating?
No.
Have you been going to the bathroom or using urinal?
Using the urinal.
Okay, so I'm going to check his urinal so I can measure his urine for intake and output. Urine is clear yellow. Okay. So I'm going to assess your lower extremities. I'm going to palpate the distal pulses, so his dorsalis pedis pulses, and posterior tibial pulses. Distal pulses are palpable and equal bilaterally. Can you push on my hands like you're driving a car? Okay, pull back the other direction. Okay. Do you have any numbness or tingling in your feet?
No.
Okay. You have full range of motion. Okay. So since you are newly post-op, make sure that you're getting your range of motion and mobility in. To avoid, because you are at risk for clots
Okay.
after surgery. So you can do push-pulls with your feet and make sure you're getting out of bed. Okay, so I'm gonna assess the dressing, but there is orders from the surgeons not to change the dressing. They want to do the first dressing change, which is common in a lot of surgical procedures. So I see that his dressing is clean, dry, and intact with no soiling. There's no discoloration to the fingers. He has some range of motion, even though it's a little sore. Pulses are palpable. So it looks good. Okay, did you have any questions for me?
So you're gonna get that medication changed for me?
Yes, I'm gonna call your physician and see if we can get you something to better manage your pain.
Okay.
And it looks like everything else in your assessment was within normal limits. The patient was cooperative and pleasant during the exam. Okay, so I'm gonna go give your physician a call and let's see if we can get your pain better under control.
All right.
Okay. All right, thank you, Mr. Gardner.
Thank you.
Need to wash my hands.